First of all, I wanted to acknowledge, I think, the deep-seated pride I think most Canadians feel about their Medicare system. It was actually during the broadcast in America of the Vancouver Olympics that Bob Costas, our announcer in the U.S., made a special point of noting that this gentleman had been voted your greatest countryman. And that was shocking, I think, to a lot of Americans, most of them who probably hadn't heard of him, nor could believe that it wasn't a professional ball player or a celebrity or actor. And so, I think there is much to be proud of. There are a lot of things that are great, things that in America we strive for, universality and issues of fairness. These are things that we're trying to build and simply haven't gotten there yet. There's an economist, Professor Evans at UBC, who's done a fantastic defense of the Medicare system. And he points out that spending on public hospitals and physicians, which is really where your single-payer system has control over, spending there has actually remained remarkably flat as a percentage of GDP. And yet, in comparison, spending in the rest of the healthcare system, in red here, has dramatically grown, where it looks very much like the spending growth curves of America. And so there are many who would argue that this is evidence enough to bring the rest of the healthcare system under public funding and public control. On the other hand, there are many critics, people arguing for privatization, saying that access to a waiting list is simply not access to healthcare. This is, of course, the famous Supreme Court decision that came out in 2005 that was expected to spark a wave of privatization, but perhaps has not quite yet. In the United States, we're facing similar arguments with any expansion of coverage. For example, through the Affordable Care Act, otherwise known as Obamacare, we brought in an additional 40 million lives that were suddenly guaranteed coverage. But the concern there is, without dramatically expanding the pool of providers, were we in fact offering coverage without care?